Hello, wonderful folks. I'm Dr. Rose Khavari, a urologist and professor specializing in functional urology and men's health, right here from the Department of Medicine at the University of Texas at Galveston, Texas. I've had the privilege of spending over 15 years working with so many amazing men and women just like you, understanding the unique health journeys we embark on as we gracefully age. In my practice, I often hear very private yet incredibly common sentiments. For example, a patient over 70 once hesitantly shared with me, "Dr. Khavari, I've lost my spouse. And now that I'm alone, how can I still enjoy intimacy or private pleasure? I feel a bit guilty even thinking about it at my age." Or perhaps another patient will confide, "My spouse and I still love each other very much, but lately I feel a lack of confidence in our private moments, so I tend to avoid them. I thought this was just a part of getting older and there was nothing I could do, and I even feel ashamed thinking about it." If any of this resonates with you, if you've ever felt a bit hesitant, embarrassed, or even guilty about maintaining intimacy and personal pleasure after age 65, especially when you might not have a partner, then today's video is exactly for you. Today we're going to talk about a topic that many people often shy away from, yet it's incredibly important for our quality of life and happiness. Why healthy masturbation matters for men and women over 65. I know it might feel uncomfortable as society sometimes holds on to outdated stereotypes, but I promise you we're going to break down those barriers together so you can feel more confident and proactive in taking care of your complete health. Because getting older doesn't mean giving up intimacy or private joy in life. In fact, there are so many gentle and effective ways to improve things, and most importantly, you absolutely deserve to enjoy that happiness. Why healthy masturbation matters for men and women over 65. Folks, as we move past 65, life can change significantly. We might have more free time or face physical changes or even experience the loss of loved ones. In this context, maintaining pleasure, self-satisfaction, or more broadly the ability to enjoy private moments with your own body is often overlooked or deemed inappropriate. Here's why I believe healthy masturbation is so important for men and women over 65. Pleasure is a natural part of being human. The ability to experience pleasure and satisfaction is a fundamental part of the human experience at any age. It doesn't disappear just because we get older, and there's no reason to feel ashamed or guilty about it. It's a way for you to connect with yourself, with your body, and maintain a sense of vitality. Benefits for mental and emotional health. Allowing yourself to enjoy private moments can bring significant benefits for mental health. It helps reduce stress, anxiety, and combats feelings of loneliness, especially important if you might be living alone or dealing with loss. When you feel satisfied and confident about yourself, you'll have a better mood, sleep better, and have a more positive outlook on life. This also helps release endorphins, natural chemicals that improve mood and reduce pain, bringing feelings of relaxation and peace. Promotes autonomy and independence. For older adults, especially those without a partner or who can no longer engage in partnered sexual activity due to health reasons, being able to find pleasure and satisfaction on your own is an important form of self-sufficiency. It helps you maintain a part of your personal identity and keeps you from relying on others for feelings of closeness or happiness. This is especially crucial in your retirement years. Improves physiological function, and overall health. Masturbation can help maintain blood flow to the genital organs, keeping tissues healthy and sensitive. This can indirectly support erectile function in men and lubrication, orgasm ability in women. Maintaining arousal and responsiveness can be a form of exercise for the body. It can also be an early indicator of underlying general health issues, encouraging you to talk to your doctor for support. Breaking down societal stereotypes. In society, there are still stereotypes that older adults are no longer interested in or capable of having a sexual life or private pleasure. This creates unnecessary pressure and guilt. By talking openly about comprehensive self-care, including private pleasure, we are helping to change these outdated perceptions, giving future generations a more positive view of aging. So there is no reason to feel guilty about healthy masturbation. It's a legitimate, healthy, and important part of self-care, leading to a healthier, more positive, and more fulfilling life. How our body and mind change. What makes us hesitate about masturbation? As we age, our bodies and minds go through natural changes. In addition, societal stereotypes and personal experiences can create feelings of shame, guilt, or hesitation about engaging in private pleasure. It's important to understand these factors so we can release unnecessary psychological burdens. 1. Physical changes and their psychological impact. Changes in sexual function. Declining hormone levels, testosterone in men, estrogen in women, reduced blood flow, decreased nerve sensitivity, and medication side effects can affect the ability to achieve and maintain satisfaction. Impact on hesitation, guilt. When the body doesn't respond as it once did, some individuals may feel frustrated, insecure, or think they are broken. This leads to feelings of shame and avoidance of self-exploration. Chronic pain or discomfort. Conditions like arthritis, back pain, or vaginal dryness can cause discomfort, reducing comfort. Impact on hesitation, guilt. Feelings of pain or discomfort might lead you to believe that seeking pleasure is impossible or even wrong, leading to guilt about having natural desires. Changing body image. Physical changes due to aging, wrinkles, weight gain, reduced muscle tone can affect how we perceive ourselves, leading to decreased self-confidence and a sense of not being worthy of pleasure. Impact on hesitation, guilt. Feeling unattractive can lead to self-denial of pleasure, believing it's only for younger or more perfect individuals. 2. Impact of societal stereotypes. Old people don't do that. This is a deep-seated stereotype in society. We are often taught that sex and pleasure are for the young, and that as we age, we should retire from such matters. Specifically, masturbation might be seen as strange or inappropriate for older adults. Impact on hesitation, guilt. These messages can make you feel that your natural desires are wrong or abnormal, leading to guilt for having them. Lack of open discussion. Due to stereotypes, this topic is rarely discussed openly within families, among friends, or even with doctors. This lack of information and support increases feelings of isolation. Impact on hesitation, guilt. When no one talks about it, you might think you're the only one experiencing this or that your issues are a taboo subject to hide. 3. Loss and loneliness. Loss of a partner. For those who have lost a spouse, feelings of guilt can arise when considering engaging in private pleasure after their loved one has passed. It might feel like betraying or disrespecting the past relationship. Impact on hesitation, guilt. This is a significant emotional burden, causing many to deny themselves the pleasure they deserve. Loneliness and isolation. Feelings of loneliness can reduce desire and pleasure, but at the same time, this lack of connection can make you feel even more isolated when thinking about your private needs. It's important to remember that feelings of hesitation or guilt about masturbation are common, but they are unfounded. They are a result of a combination of natural physical changes and incorrect societal stereotypes. By recognizing and overcoming these barriers, we can allow ourselves to enjoy a more fulfilling and happy life. Understanding right versus wrong, debunking common misconceptions about masturbation in later life. When we talk about masturbation in retirement, there are many common misunderstandings and societal stereotypes that can make you hesitant to learn about or seek help. Let me help clarify a few things for you. Misconception. 1. Masturbation is a childish act, or only for teenagers, young adults. The truth, absolutely not. Masturbation is a natural, healthy part of the human experience at any age, from adolescence to older adulthood. It's a safe and private way to relieve stress. Explore your body, maintain sexual function, and find satisfaction without relying on a partner. Misconception number 2. If you are married, masturbation is a sign of an unhealthy relationship or disrespect towards your partner. The truth, not at all. Masturbation within a relationship can complement intimacy with your partner rather than replace it. It can help you better understand your own body, relieve tension, and even increase libido for partnered activities. It's especially useful when a partner has health issues, differing libidos, or when one partner is absent. Open communication is key. Misconception. Number 3. Masturbation is harmful to physical or mental health. The truth. There is absolutely no scientific evidence that masturbation is harmful. On the contrary, many studies show it can offer health benefits such as stress relief and mood improvement, releasing endorphins, the feel-good hormones. Improved sleep helps relaxation and makes it easier to fall asleep. Pain relief can help alleviate minor pains, including headaches or cramps. Maintaining sexual function helps maintain blood flow and sensitivity in the genital organs. Increased self-awareness enhances understanding of what brings you pleasure. Misconception. Number 4. Problems with sexual function, like reduced sensitivity, difficulty achieving orgasm during masturbation, cannot be improved. The truth. While age can bring natural changes, many sexual function issues have medical causes that can be diagnosed and treated. For example, poor blood flow, hormonal imbalances, nutritional deficiencies, or medication side effects can all impact your ability to enjoy pleasure. Blaming everything on old age might cause you to miss effective solutions that can significantly improve your ability to experience pleasure. Misconception. Number 5. Masturbation is something you should never talk about with anyone, even your doctor. The truth, masturbation is a private topic, but there's nothing shameful about having questions or concerns about it. Doctors are medical professionals trained to discuss all aspects of your health, and they are accustomed to these issues. Openly sharing will help you receive the necessary information and support to improve your quality of life. You are not alone, and seeking help is a brave act. By debunking these misunderstandings, we can release unnecessary feelings of guilt and open the door to a deeper understanding of our bodies, leading to positive choices to enhance personal pleasure and a more fulfilling life. Simple habits to improve nutrition, movement, and self-acceptance for healthy masturbation. Now we understand why healthy masturbation is important, and we've debunked some misconceptions. So, what can we do right now to improve and release this burden? Today, I want to focus on enhancing the ability to masturbate through nutrition and lifestyle, and promoting self-acceptance and openness. Enhancing masturbation through nutrition. The foods we eat are the foundation for physical and mental health, directly impacting our ability to experience pleasure. 1. Boost blood flow and sensitivity. Good blood flow is critical for physiological response and the ability to achieve orgasm. Natural nitrate-rich foods, dark leafy greens, beets, help produce nitric oxide. No, which dilates blood vessels and increases blood flow to the genital organs. Action: add 1 to 2 cups of dark leafy greens daily. Try beet juice or beet salads. Omega-3 fatty acids, fatty fish, flax seeds, chia seeds. Reduce inflammation, improve vascular health and blood circulation. Action: eat fatty fish 2 or 3 times a week, or supplement with seeds in yogurt or smoothies. Antioxidants: berries, pomegranates, bell peppers, dark chocolate. Protect cells from damage and support circulation. Action: eat a variety of colorful fruits and vegetables daily. Enjoy low-sugar dark chocolate. 2. Support hormone balance and energy. Stable hormones and energy are crucial for libido and responsiveness. Healthy fats: avocados, extra virgin olive oil, nuts. Essential for sex hormone production and maintaining healthy cell membranes. Action: include healthy fats in every meal. For example, half an avocado, a tablespoon of olive oil, or a small handful of nuts. Zinc: pumpkin seeds, oysters, lean beef beans. Important for testosterone and overall hormone function. Action: add zinc-rich foods to your diet. High-quality protein, lean meats, eggs, beans, lentils. Provides sustained energy and supports mood-related neurotransmitter production. Action: ensure adequate protein in each meal. 3. Reduce stress and improve mood. A good mood is a prerequisite for pleasure. Magnesium: dark leafy greens, dark chocolate, nuts. Helps relaxation, reduces anxiety, and improves sleep. Action: add magnesium-rich foods to snacks or dinner. B vitamins, whole grains, eggs, fish. Essential for nerve function and energy production. Action: prioritize whole grains and B vitamin-rich foods. What to limit or avoid to maximize benefits: limit refined sugars and processed foods, cause inflammation, blood vessel damage, and blood sugar dysregulation. Trans fats and excessive saturated fats can promote inflammation and cardiovascular issues. Excessive alcohol and caffeine affect sleep hormones and nerve function. 2. Promoting movement and self-acceptance for healthy masturbation. Overcoming hesitation and guilt requires a combination of physical and mental changes. 1. Movement to improve blood flow and energy. Exercise is a fantastic medicine for the entire body, including sexual function. Cardiovascular aerobic activities. Brisk walking, swimming, cycling, dancing. Why it helps: boosts heart health, helping pump blood more efficiently everywhere, including the genital area. How to exercise: aim for at least 150 minutes of moderate intensity activity per week. Kegel exercises, pelvic floor. Why it helps: strengthens the pelvic floor muscles, which improves local blood flow to the genital area and enhances sensation, orgasm ability, and bladder control. How to exercise: perform 3 to 4 times daily, 10 to 15 contractions and relaxations each time. Consult a pelvic floor physical therapist for proper technique. 2. Self-education and self-acceptance. Learn, read articles, watch videos like this one about sexual health and masturbation in older adults. When you realize changes are normal and manageable, shame decreases significantly. Self-acceptance. Recognize that desire and the need for pleasure are a natural part of you regardless of age or relationship status. You absolutely have the right to enjoy your life. Practice self-compassion. Be kind to yourself. You've lived a full life and you deserve happiness and satisfaction. 3. Seek professional support if needed. Talk to your doctor. Don't hesitate to openly discuss any concerns about sexual function or the ability to experience pleasure. Your doctor is a trained professional who can help you identify medical causes and suggest appropriate solutions. Consider sex therapy or counseling. If guilt or psychological anxiety is overwhelming, an experienced sex therapist or counselor can provide a safe space to explore these emotions and develop coping strategies. 4. Rediscover pleasure on your own terms. Once you've released psychological burdens and improved physical health through nutrition and movement, allow yourself to rediscover what brings you joy and satisfaction. This can include self-stimulation using sex toys if appropriate and safe, or non-sexual forms of intimacy with a partner. The key is to focus on your own pleasure and comfort. Remember, your choice to live a full life, including enjoying private pleasure, is a brave and empowering act. Sharing a real story. I want to tell you the story of 2 wonderful patients of mine, Agnes, 78 years old, and Harold, 72 years old. Both were widowed. Agnes came to me looking very sad. She said, "Dr. Khavari, I just thought that since I'm old and alone, there's no more joy for me, especially private joy. I felt embarrassed even thinking about it, but I truly missed the feeling of aliveness and satisfaction in my body." She felt lonely and thought private pleasures were taboo. Harold seemed a bit more open, but also carried a burden. He said, "I still have natural urges, doctor, but I feel ashamed thinking about enjoying them alone. It's as if society tells me I'm not allowed to have these needs anymore." I had a very thorough conversation with both. I explained that their feelings were completely normal, and the guilt stemmed from incorrect societal stereotypes. I encouraged them to focus on nourishing their bodies with good nutrition and practicing self-acceptance. I suggested Agnes increase her intake of dark leafy greens, fatty fish, and nuts to improve blood flow and hormones, which would affect sensitivity. With Harold, we focused on reducing sugar and processed foods to boost energy and mood, indirectly impacting desire. Most importantly, I encouraged both to practice self-compassion and understand that masturbation is a healthy part of self-care. I also emphasized that discussing these things with a healthcare professional is perfectly normal and necessary. Initially, both found it a bit challenging, but they persevered because they wanted to rediscover joy in life. After about a few months, both Agnes and Harold returned to my office with radiant smiles. Agnes excitedly said, Dr. Khavari, I can't believe the difference. I no longer feel guilty. I've rediscovered the feeling of aliveness in my body. I realize that taking care of myself and enjoying private moments isn't betraying my late husband. On the contrary, I feel happier, and that gives me more energy to live life to the fullest. Harold also chimed in. That's right, doctor. I've shed the burden of shame. I now understand that taking care of myself both physically and emotionally is something I deserve. I feel so much more confident. The story of Agnes and Harold is a powerful testament that releasing guilt and actively caring for oneself through nutrition and self-acceptance can bring about profound impacts on your pleasure and overall happiness as you age. It's not a complex magic trick. It's simple bodily science and psychology at work, helping you enjoy a full life in every aspect. So to recap our meaningful conversation today, here are the key points I want you to always remember. Older adults shouldn't feel guilty about healthy masturbation. Pleasure and satisfaction are a healthy, natural part of life at any age, regardless of relationship status. Feelings of guilt often stem from natural physical changes and outdated societal stereotypes, but these can be overcome. Enhance masturbation ability through optimal nutrition. Boost blood flow and sensitivity with dark leafy greens, fatty fish, and berries. Support hormones and energy with healthy fats. Zinc, vitamin D, high-quality protein, and magnesium. Limit processed foods, refined sugars, unhealthy fats, smoking, and excessive alcohol. Promote self-acceptance and openness. Educate yourself about sexual health and masturbation in older adults. Talk openly with your doctor and partner if applicable. Practice self-compassion. Remember, small, consistent changes will lead to big improvements over time. This is about smartly nourishing yourself, not a restrictive trade-off. You can start today by adding a serving of dark, leafy greens to your meal and allowing yourself to enjoy private moments without guilt. Dear friends, your health journey after 65 is a unique and precious one. It's a time for wisdom, for enjoying the fruits of your labor, and for savoring every moment. And proactively caring for your healthy masturbation and nutrition is one of the kindest, most empowering things you can do for yourself and for your relationships. You have the power to influence how you feel, how much energy you have, and how vibrantly you experience life. Start today, one healthy step at a time. Listen to your body, allow yourself to seek healthy solutions, and watch how your life becomes richer. You deserve to feel your absolute best every single day. If you found this conversation helpful, please consider subscribing to my channel. I'm here to support you on your journey to a healthier, happier life after 65, with more practical tips and insights on health and positive living. Wishing you all abundant health, boundless energy, and joyful days ahead. Until next time, take good care of yourselves.